Hello and welcome to the Maiden edition of your program, Healthcare Today. Healthcare Today is your foremost informative program on TV that aims to showcase the five-star healthcare services taking place in Nigeria. We often talk about the ills, of healthcare in Nigeria, but the truth is we have a number of good services going on around the country, mostly pioneered, by the private sector, but also some in the public sector. And therefore, this program is aimed to showcase those services so that we can point you in the right directions when you need certain level of care. In today's edition, we take a tour of two major hospitals in Abuja. One is the Cedarcrest Hospital, and the other is the Cardio Care Hospital, both located at the Federal Capital Territory here in Abuja. Let's take a quick break. When we return, we shall be going straight to the Cedarcrest Hospital. My name is Dr. Benson Ayodele Cole. I'll be your anchor on this show. Welcome back. And if you're just tuning in, you're right on time because we're just about getting started with the visit to the Cedarcrest Hospital here in Abuja. Cedarcrest Hospital is one of the leading private hospitals in Nigeria with headquarters in Abuja, but they also have operations in Lagos, in Port Harcourt, and then a few places in Niger State. Now, Cedarcrest Hospital was primarily designed as an orthopedic hospital, but they also render services in other areas of clinical specialty, such as internal medicine, obstetric and gynecology. They also have nephrology services. They do ear, nose, and throat treatment, as well as physiotherapy and general practice. But we shall be taking an in-depth look, at the orthopedic care at the Cedarcrest Hospital, because that is one of the major areas of their specialization, and also the support services they render in physiotherapy and the likes. Take a listen.
We have in total about 30 visiting and in-house consultants who cover a wide spectrum of services. Now, some of the key ones are our flagship, which is the prosthetics and prostheses. That's the P&O. So we have an in-house manufacturing plant where we manufacture artificial limbs, arms, legs, and those sort of things. So it's a key service for us. Not many private institutions have that. So we are happy to be in the forefront of pushing the envelope in terms of the service to provide for those in need of prosthetics and prostheses. So that's one of them. I mentioned earlier that we have a molecular laboratory which is used for COVID-19 testing. So traveling and returning passengers can always visit any of our locations where we offer such services. We have an MRI, we have an interventional suite right now, which is the interventional cardiology. So we offer, high-end interventional surgery for people in need of such services. So these are some of the key things. We've recently revamped our pediatric suites, so there's a lot of that going on as well, that we're happy to help reverse medical tourism back home into Nigeria.
Cedarcrest Prosthetic Center is an arm of Cedarcrest Hospitals Limited, and we are affiliated partners with Ottobock, Germany. At Cedarcrest Prosthetic Center, our core strength is the respect to prosthetics and orthotic fittings, both upper and lower limb. We have specially trained professionals in Europe, both the orthotics, the prosthetics, as well as our physiotherapists. We've had a couple of patients coming here since establishment of this center in 2017. So we had our first patient September 2017, and between 2017 and now we've had several patients who had completed their fittings here. We have about 150 prosthetic patients so far and well over 300 orthotic patients. We've carried out several levels of fitting, such as above the knee, below the knee, We've been able to return several of our patients back to function, back to work, back to their usual routine. And these patients are usually followed up even after discharge to ensure that they remain happy in the use of their devices. And we have also been able to fit a couple of patients with braces, such as the scoliotic brace, the ankle foot orthosis, knee ankle foot orthosis, upper limb prosthesis, and so many other different solutions to meet the diverse musculoskeletal challenges that individuals encounter in their course of recovery. Yes, so at Cedarcrest Prosthetic Center, we've got state-of-the-art equipment such as our infrared oven and the convection oven. We also have lamination machine. These are the state-of-the-art device equipment and tools that we use for our fabrication processes. We also have the router. We've got the laser posture. We have the static process assembly. All of these are necessary at various stages of our fitting. For instance, the process of our fitting starts with casting. So we have our casting room in the patient area. So our process starts with casting patients. So when patients present to us, we have an assessment done. Following the assessment, we're able to compile the list of materials and components that is needed to complete their fittings. And then once this had been assembled or had been procured, patients are invited, and then the fitting commences with the casting. So the casting is done, and they are taken to the modification room where all the adjustment is done to the cast, and then tried again on the patient. And then we'll go to the oven. So using either the infrared oven or the convection oven, we're able to mold the sockets and then get the shape of the socket that the patient is meant to use, and then start with the training. And then we'll have the interim phase. So the interim phase, patient is able to use the sockets, the check sockets as they are called, and with the components attached such as the foot and the pylon. So they are able to use this to commence their training. And then when they have mastered the use of these interim components and have passed through this interim phase, they are also asked to go through the home phase. So during the home phase, patients are able to use these devices and then come back to us with feedback as regarding how comfortable or how satisfied they are with the device. And of course, when there are challenges like pain or some discomfort, modifications are done to ensure that the patients are comfortable and happy. So once we've been able to achieve or attain this state of comfort for the patient, then we progress to the final stage, such as going for the lamination process using the lamination machine. And once this is done, patients are fitted, we do the cosmetic finishing, and then patients usually come back to give us an acknowledgement receipt saying, I am happy with this device, and then they are discharged. And then a couple of weeks down the line, we put up follow-up calls to these patients just to ensure that they remain happy with the use of their device, because majority of the challenge we've realized with use of prosthetic and orthotic components is that over time certain changes takes place, and most of these individuals either tend to abandon their devices due to the pain and discomfort that they experience, or they just keep complaining or keep managing it, and in the event they just cause more harm to their stump. So we ensure that our patients remain happy. We call them 2 weeks after they are discharged, 6 weeks after they are discharged, 3 months after they are discharged, 6 months after they are discharged, even after a year and beyond, getting feedback that will help us to further improve our processes and also to ensure that they remain happy. So in the case where there is need for some form of amendment, we'll invite them to the center at their own time. They come and we make sure everything is in order. At Cedarcrest Hospitals, we have got referrals from both within and outside of Abuja, coming from other big hospitals, both within the city and outside the city. We've also got referrals come from Ghana, we've got referrals come from Rwanda, and we have successfully fitted these patients, and they have gone home and had continuously remained happy using their devices. Several of the referrals we get, or several of the patients who had fitted here at the center, come from outside Abuja. Some of them come from Lagos, from Gombe, from Maiduguri, from Enugu, from Port Harcourt, all because of the state-of-the-art equipment and technology that we offer at Cedarcrest Prosthetic Center.